Hi everyone, this is Dr. Beatrice Constandache, and I am pleased to have by my side my colleague Ulrich Frohberger to talk about today osteoporosis, so low bone mineral density, as a first topic of some of the questions that I had during my speak at the Global Women Summit in London. There I have been approached with many questions regarding women's health, medicine for women, and that's why I realized this need of good information from medical information from people who do it the best, and why not start with my colleague Ulrich Frohberger, one of the best leading specialists in Germany on what regards osteoporosis, so low bone density, mineral density in women. Today we're going to talk about women's health, so that's why please Ulrich, we are happy to find out how can we help women that have osteoporosis. And a bit tell us about your work here in the center of Münster, just to see if women can be helped in what regards specialized medicine on their perspectives, on what regards the women approach. Yes?
Hi everyone, I thank very much that I am invited to speak with you about osteoporosis, and I'm pleased to work with Beatrice about this theme of osteoporosis, very important for women, not only for women but mostly for women. And the reason is that more but 3 of 5 ladies over 50 years will have osteoporosis in the future, and this is not only as they become older or mother had osteoporosis. Most of reasons are beginning some years ago, and when we look in earlier times, if we are on the way to osteoporosis, we are able to change a lot, and so we are able to work that we will not have osteoporosis, and most important, that we will not have a fracture by osteoporosis. This is a very hard situation, and so our first work is in younger years to look for your health, for your way of living, of working, of sport, of eating, and that we can do all that you will not be in the situation to get a fracture. And this is a very good working, better I think, but only the best drugs if you have a fracture. Our first interest is that you will never have a fracture, and this is a very nice working together with you, Beatrice.
What is the most important thing that we have to look in when a female patient comes with osteoporosis? What is the first thing that we look at?
First we look for the person, what she had in the life before, how she is going, how she is sitting, how she is speaking, how much muscles she have, and we look for her whole health situation. And then we like to hear a lot of her, of the life before. We look for her body, so we look for an undressed body, the movement, muscles, and so on. And we see a lot of things. They show us how healthy they are, or if they are on the way to osteoporosis, as a lot of muscles are very good against osteoporosis. Less muscles are bad for the health, and the risk of osteoporosis is bigger without muscles and without training. And so some other things are very important to work for the situation that I will not have a osteoporosis. And so first, when we see our patients, we look where they live, how they eat, how they make sport. We like to know more of the person first.
What biochemical lab tests should we do when we have osteoporosis?
First, it is important they are healthy of liver, blood,
Liver.
fat and so on.
Yes.
But very interesting in the osteoporosis situation is vitamin D. A lot of us, and mostly we do not like to go in the sun without any clothes. This is the only way to have enough vitamin D. And mostly we work in the houses, in the rooms, and we go on the street with clothes and so on. And so we do not have enough. The very important vitamin D. And this is one of the first important things we test in the blood, vitamin D, omega-3 acids and minerals in the blood cells.
Mm-hmm. We had a patient today with vitamin D value under 5 nanogram per milliliter. What does that mean for our body?
Vitamin D is so important for feeling, for the whole health, for the immune system, to be happy, for be able to be trained. And vitamin D is one of the most important things, like to eat or not to eat. We need vitamin D to be healthy, not only for the bones, but for the whole of the body.
Okay, thank you very much. When you have any questions or you want for me to answer or Ulrich, please go into the comment section and address there your question and we will respond to them. Thank you very much. We will see you soon. Bye.